And talk about some of the early research behind the effectiveness of GLP-1s. What are you finding in the research? What does the early research show?
We have kind of two flavors of research. The first flavor is retrospective research. So that's looking at patients who have been prescribed GLP-1s for weight loss or for type 2 diabetes, and then retrospectively seeing what the outcomes are related to substance use disorder. And on the flip side of that, we have prospective research. So we have research where we take a group of patients, hopefully they're randomized. So they randomize to some receive GLP-1s, some receive placebo, and then prospectively, we're able to measure the effect that the GLP-1s have on things like alcohol consumption. In the realm of retrospective research, it's just staggering. There's large cohort studies from around the world where patients in hundreds of thousands to hundreds of thousands of patients in large EMR systems, large electronic medical record systems, have reproducible signals that they decrease alcohol use disorder, they decrease alcohol-related admissions, they decrease nicotine use, they decrease opioid-related hospitalizations. The most recent and one of the most powerful of those studies was one that came out of the US, 600,000 US veterans in the VA. And what it showed was a near 20% reduction in diagnosis with some people who didn't previously have substance use disorder. What's amazing about this study and what we're seeing in the field is that this was somewhat substance agnostic. So it showed a 20% reduction in alcohol use disorder, opioid use disorder, stimulants, nicotine, kind of across the board. In patients who had already had a diagnosis of a substance use disorder, what this paper showed was a 50% decrease in all-cause mortality. So really, really big study, really well-powered, really, really big signal. Now on the prospective side, there's two large randomized control trials. One was in 2025, one in 2026. And really what we're showing there is that there's a profound effect on alcohol intake. So the Henders shot at all paper showed about a 40% reduction in alcohol intake. 20% of the treatment arm had no drinking days at the end. And the paper that followed that up earlier this year, again, recapitulated that in randomization at slightly higher doses. So I would say right now that the data is overwhelming.